Hey everyone, welcome to another episode. I'm Will Huebner here with Mark Mashashik. Got a big episode today. We're going to be talking about COVID and the NBA.
Very
a lot of
exciting.
players saying that they don't want to play. Should they play? Should they play in Florida? So we'll kind of get into that. We're also going to be talking about Jamal Adams, Dak Prescott, and from a health perspective, we're going to be talking about knee osteoarthritis, particularly in runners, in active individuals.
Or even non-active individuals. Who's at the biggest risk here?
Who's at the biggest risk long term? So let's get right into it. Let's start with the NBA and COVID.
Mm-hmm.
So they're scheduled to start
July 30th.
July 30th, very soon. A lot of players nervous about Florida in general, one of the states with the highest active amount of episodes.
It's kind of weird. How do they not see that coming? That it was the first state that opened up. You had the kids for spring break. You kind of had to know that Florida was gonna, if anyone was gonna boom again, it was gonna be Florida.
They're up to about 4,000 per day, and that's climbing.
Yeah, so why did they pick Orlando? It just seemed like a good spot. I mean, the idea is, I guess they're going to be in this bubble and they're quarantining themselves anyway, so they should be safe. But if you've got employees,
well, that's
custodial workers coming in and out,
players, coaches, assistants, all those people are going to be tested regularly. But the staff at Disney who are going to be coming in and out of the facilities will not be tested regularly. They already said that in part of their health diary that they sent out, the little information packet. So it's stressing a lot of the NBA players out, and guys like Kyrie.
How much COVID is there in Bangor, Maine right now? Why didn't they play in like Siberia or something? Why didn't they play somewhere there's no COVID? I guess the facilities are just perfect in Florida, but it's where the most COVID is, and that's one of their biggest concerns is contracting COVID.
Yeah, I don't know. I think originally there was a thought that the hotter places tend to decrease the amount of COVID for whatever reason.
That's fair. But cold places, nobody lives there, so you don't got to worry about COVID. They did it in Juneau, Alaska. I would say the chances of catching COVID be very low.
I don't know.
The North Pole, you got elves for referees.
But we're seeing guys like Bertans on the Wizards choosing not to play.
So
Trevor Ariza not playing.
So there are different reasons for why they're not playing, though.
So Burton's reason is that he is a free agent after this year, and he has had multiple injuries in the past. He does not want to risk getting any injury prior to making a lot of money.
He's doing the old college football bowl skip. Not worth getting hurt before the paycheck.
But the Wizards are saying openly, hey, that's his right to choose that. We are more than happy to not have him for the year. We're actively going to try to get him in free agency to a longer-term deal.
Well, I think the Wizards' purpose in this whole league right now is to lose some games to the middle team so that they can so these other teams can get in the playoffs. I think if he was on the Lakers, they might not be as happy about it. The Wizards aren't going to go anywhere. They're still clearly building for the future. So yeah, him staying healthy doesn't really hurt their team very much. If anything, don't they just want to tank out and get a better draft pick? But his concern doesn't seem to be COVID. So he's saying it's right. That. I mean, we're not training the same way we had been training. Guys out there are going to be like a bull in the china shop. Maybe someone gets hurt.
Sure.
So we haven't seen a lot of guys just in general during a regular season. Towards the end of the year, they're a free agent next year, and they just say, well, I'm going to hang it up for the rest of the season. And that's sort of what he's saying he's going to do if it's not about the other stuff.
Yeah, we haven't seen too many players actively say they don't want to play due to COVID.
But that's not what he's saying.
Right, I'm saying we have not seen many people saying due to COVID, I'm refusing to play.
Right.
We're seeing Kyrie,
we've heard reports that people are saying that, but we're not getting specifics.
Right.
So Trevor Ariza is one that makes a lot of sense to me. He's saying he doesn't want to play because he wants to spend time with his son. So obviously, in this quarantine, I don't think they're allowed access to their family for a particular period of time. And Ariza saying, where's Ariza right now? Portland.
Yep.
He's saying he doesn't think they're going to win it. I'd rather be with my kid.
I mean, that's a great reason.
It's an awesome reason. How can you you can't bash that reason. Your kid's only 2 once,
Right. And then the other two guys that we know of are Avery Bradley, Kyrie Irving. Again, nothing to do with COVID. They feel like playing basketball at this time is going to take away from the protesting and kind of the momentum we're getting towards hopefully improving some of the racial injustice in this country. Which is, as we talked before, to us it seems like you'd want basketball because now you have a bigger platform to go after some of those.
Yeah, I agree with
issues.
But at the same time, I support however they want to attack that issue. I think that they should follow their heart and do it. I think it's weird that Kyrie gets a bad rap for always being sort of like a bad locker room guy, and now he's injured and he's saying no one should play, but he's already injured. It's like it. If it was coming from other people, it would sound a lot better than from Kyrie being injured. Just seems like if LeBron plays, that expands the platform for Black Lives Matter. He gets out there and he talks about it before the game, or he does his, whether it's kneeling or whatever gesture they decide to do. I think that explodes because everybody's dying to watch these games. You're gonna have probably what are you gonna have 50 million people watching these games and therefore gestures to expand on. I think it's gonna be positive.
Yeah, yeah, I'm excited. Let's go into percentage though now with what we're seeing
Well,
about Florida.
go ahead.
Well, just what we're seeing with Florida. They're scheduled to play late July. I'm now thinking that they're actually not going to play basketball. My gut feeling is 75% chance that they will have a change of heart and they will say we're actually going to either push it back or we're just going to wait, see how things play out until December when we start the
Well,
regular season of 2021.
I'm way off from you.
What are you saying?
10%.
10% chance that they
Don't.
don't play.
I go 90. I think, dude, there's people going. I think LeBron's in Orlando right now.
Yeah, but that doesn't mean that they're going to make everybody go in quarantine there yet.
Oh man!
As you're seeing the cases increase from 3,400 to 4,200 and continuing as we expect to continue to rise, it just doesn't seem like that's the image that the NBA wants to give from a PR perspective. Maybe they find a new place where there's less cases, or I don't know, or they say let's just push it back. It's not player safety is the most important thing for the NBA. We're not going to risk.
But we all. I mean, if we're going to be honest with ourselves, this isn't truly about player safety. It's about public relations. It's about looking good to the public for player safety.
Yeah, for sure.
But you brought up what if we all we don't know how COVID reacts exactly with everyone, but we have seen that people with healthier immune systems do tend to do better. If the professional players that we have seen contract it really haven't reported many symptoms at all. But what if we did? What if they do play basketball and we see someone get really sick and God forbid pass away or something?
Right.
How do we react with that? I think that shuts everything down till vaccine.
And if you're talking about PR, whatever sport it was, whether it's bull riding or whatever it is,
it's gonna kill.
That's the one that's gonna get crushed.
Right. I'd still say, what do you? If it was me, if I'm, who's like a middling guy on a good team, like if I'm
basketball,
yeah, give me
Let's
some.
do Spencer Dinwiddie,
but he's in Brooklyn.
Okay.
Give me some. Who's below? Who's the next best player after Lou Williams on the Clippers?
Montrezl Harrell.
Yeah, if I'm Montrezl Harrell, I really want to play.
Yeah, and I think that's the thing. You're not going to have a difficult time finding people who want to play. If the stars sit out, like you said, at this point, fans want to see basketball. They want to see any sport. So you could get minor leaguers, G leaguers, whatever you want. You put something on TV right now, it's going to get watched. Korean Baseball League is going. Ratings are going through the roof.
When you look at knock LeBron for what you want. When you look at LeBron's attitude towards winning and what his legacy means to him, do you think there's any way he doesn't want to play? I don't think he's talking about it because it's controversial for all these other topics, because some people are saying don't play for this reason or don't play for that reason. Do you think there's any chance that he doesn't really want to play?
No, I think he really wants to play to try to win a championship.
I think he's I think he has more power than Adam Silver. I think if LeBron says we're going to play, they're going to. I really do. I think he has more power than Silver. I think I think he shifts public opinion, and public opinion shifts relations for the NBA. I think he's tremendously powerful. I think if LeBron's in Florida right now, I think the chances of playing are very high. And we don't know what the right answer is. God forbid something terrible could happen. But I think it's going to happen. So how would you rate the three sports? What do you think? But between the big ones, football, baseball, basketball, what do you think is the most likely we're going to get and the least likely we're going to get?
I will go most likely we're going to get is football, because it starts later than all the other sports.
Pushes off a little bit more.
And there's been no real talks of anything changing at this point. I think actually they did just start to talk. Are they going to push the regular season back a week or two?
Yep.
But I think that's more to see if they can get more preseason games in.
Yep.
If you're going like baseball at this point, it just seems like both sides are so far off that there's no way we have a season.
I agree, and it's already late into the season. Like, it's just getting harder and harder to see it happen.
I would say 5% chance we see baseball this year. And it stinks because I really think you could get minor leaguers who don't make much money, and this could be their one
But
chance to get out
I
there.
think the problem is they're in the union as well.
Right.
They are. Yeah.
For sure.
So they'd have to be. We haven't had union. What's someone who breaks the union? Is that a scab? I think that'd make you a scab. When you work and you're in the union, you're not supposed to be working. So
Right.
So they look bad to their role models. It's not a good thing. I'll still go higher on both. I'll still go 25% on baseball.
What's the deal with the? Well, let's going back with this. Basketball already said I think 25% chance that they do play. You were a little bit higher on that one.
Yeah, I think 90%
that they do play, and then if they do play, I think eventually somebody's going to end up with a positive case, and then I think you're going to be in the point where okay, season shut down. Like you said, LeBron has the most influence. Imagine LeBron tests positive, NBA shutdown.
LeBron is very likely going to be fine.
I agree, but you're looking at what's the worst case scenario. All these people can't go back to work yet, but LeBron James can go back. I think it's just taking an unnecessary risk.
What about all these people who can go back to work? Why can't he? You know?
No, I hear what you're saying.
I know that we're in a field where we have to, we're considered necessary,
right?
So we have to see people, but neither of us have had any symptoms of getting sick. And if you told me that I couldn't work, I would still want to, and we are.
Mm-hmm.
So it's safe enough for us to see between 15 to 25 people through employees and everything a day, but it's not safe enough to be on the court with 9 other people.
Well, we're also, I think, in the grand scheme of things, doing potentially a more impactful job. We are creating people after trauma and big surgeries and getting them back on their feet and getting there.
I still think people sell short what competition means. I know it's not absolutely necessary, but I think the effect can be far more grand than what we look at. I think as far as getting people to communicate and lifting spirits and pulling some people out of the other negatives to COVID that aren't talked about as much, social depression. I mean, we're going to lose people to drug abuse, suicide. These are things that really can be affected by COVID. And I think some things that can help with that if we can do it in a safe way. I think we sell basketball short to say it's just a game. I do.
If you're Adam Silver and a player, Kawhi, LeBron, a big star, goes down with COVID.
What do you mean goes down?
It's tested positive and he needs to be removed from...
Well, they're going to have to be removed if they test positive.
Right, for 2 weeks. That's going to change the entire... Now the Lakers are not a top team. Now the Clippers are not a top team. It just changes the dynamic, and I think it makes it a problem for the NBA and PR is like, now LeBron saying, well, you only won because I wasn't there, and you know...
Well, that's all that... I mean, those... To me, from a looking at it from a Adam Silver standpoint, that's drama that it's not good if anybody's getting sick, but that's drama that we don't usually see that can elevate some exciting things for the NBA. All of a sudden, you get a guy who has to sit out. He's fine, but he's sitting out. LeBron's out, and now Kawhi's out too. And all of a sudden, you see, I don't know, one of these middle tier teams come up and they start running away with it. There is drama to that. LeBron can't come back until Game 6. Can they make it without him to Game 6? These are all storylines, and I'm not saying that the NBA is just a storyline, but there's things that people will tune in for to see this. God forbid anybody gets hurt or gets
right.
Really
That's
sick.
The bigger danger is that there's a chance that LeBron gets seriously sick to the point where I know you're saying it's a low risk, but it's still a risk.
What does Fauci say? Fauci says don't play, right?
Yeah, he's saying avoid all, which, yeah, he's saying, well, he said football for sure. No playing football. I don't know if he's come out on a direct statement about basketball.
I don't know how honest he obviously has to be on the most conservative side of that. But the other things we didn't talk about football was we got a lot more guys.
Yep.
And
more physical contact.
Yeah, more physical, and you've got 104 people there instead of 30. And you said, because the season's later, I'm just wondering if we just haven't hit the panic of it yet because we're not close enough to the season. Where the NBA, it's here now. They're addressing it now, so that's why maybe it's more of an issue. Don't forget the WNBA either. Maya Moore saying she's going to sit out, and a lot of their stars not returning. Let's remember that they're not as well compensated as the NBA is, and just deciding to work on other things as opposed to go with the risk of getting sick.
Yeah. at some point, as a fan, it starts to be like, all these players are saying, for the love of the game, we'll play, pay me nothing, still be playing. And now you get to these points where it's like they're really not saying that they're not playing because of COVID. A lot of them are saying, I'm not playing like baseball, I'm not playing because you're not compensating me like you should be. Same thing, there's been issues with that with basketball. Are you going to compensate me for the whole season? What's going to go on with that? And it just seems like now all these guys who originally were saying that we're going to play no matter what because we love the game, it's more, well, we're not going to play because it's all about money for us and this is a job.
I see both sides to this one. I mean, when you're in a union, you can't let the man nickel and dime you and push you around, and you have to stand together with the union. So I get it, but working with kids and seeing kids who would like to go to a Major League Baseball game this year, tell them like, baseball's a great sport, but they don't know that they've never been to a game. It's hard to. That's what it's about. It's supposed to be about the kids. It's supposed to be about the nostalgia that you have when you're a kid and you walk into the baseball stadium for the first time. And it is a little sad that it's about a couple $1,000,000 for a guy, but I know why a union exists. I mean, I think the owners are probably more on the wrong than the players are, but it certainly doesn't look good on anybody.
Yeah. All right, let's go into Jamal Adams.
Yeah.
Safety for the Jets, demanding a trade.
Maybe the best safety in the game. One of these game changer guys.
Clearly a guy the Jets do not want to keep. They don't like keeping good players.
Right. If he's good, they think that he could be good even with Adam Gase, and they're worried about that. So they're trying to get him out of there.
So he made a list of 7 teams that he potentially go to.
And I think it's going to happen.
They're talking now specifically, media in Dallas seems to get out a little bit quicker than everywhere else.
So we got the 7 teams: Ravens, Cowboys, Texans, Chiefs, Eagles, 49ers, and Seahawks. I think he was in Texas, and someone yelled at him, "Come to the Cowboys," and he yelled back, "I'm trying my best." That's a big change for the Cowboys. I think the Cowboys have a couple questionable defensive players who, if they play well, that defense could go from pretty mediocre to pretty darn good, and their offense is already on fire in fuego. That's a guy who could turn Dallas around. Jamal Adams can play like every position. He's one of those guys. Derwin James, this very special player who's not just a safety but a defensive weapon.
Cowboys tend to have enough money. Jerry Jones tends to dish out money wherever they need it.
I think it's a good fit. But I think all these teams are a good fit. I would say the Seahawks are a little bit on the downside on their defense. I would rather see them get a pass rusher than a safety. But, I mean, he fits there. The 49ers, oh, my God. Could you imagine him going to that defense? Eagles is a fit. Chiefs next to Tyrann Mathieu with those two guys making plays. That's a good defense. Chiefs are a sleeper defense this year. They were good towards the tail end last year. Texans are weak. Something you just must like Texas. It's a good team overall still. Cowboys would be a good fit. And, of course, the Ravens. Man, that would be nasty too.
Ravens have been trying to get him for a while.
They had a problem with safety for a while. They just couldn't get a long-term safety. And they got Earl Thomas, and now he was almost cut, and he's not cut, and he's 32, and he's doing these crazy sex things with guns
and brothers.
We don't have to get into the details.
Yeah, we don't have to get into the details. But reasons that the Ravens are not maybe thinking long term with him, age probably the biggest factor of all there.
Yeah, and a little less performance than his good safety last year, but not the same as the Legion of Boom days.
But then, so going back, so now Cowboys are also just offered Dak Prescott $31 million.
He just signed it. He signed it today. $31.4 million. So, what do you think? Franchise tag for $31.4 million. Who wins it? Is this good for Dak? Is it good for the Cowboys?
I think it's, I don't know, kind of right where they should be in a sense. Dak wanted 40, wasn't getting that. Cowboys weren't willing to give him a long term.
Right. Cowboys look bad on this though. I mean, they probably could have got him for 30 a year for 4 or 5 years if they did it a year ago.
But they might not want him long term. I don't know if they're sold on him.
So that's where everybody wins a little bit. I mean, you dish out $31 million, it's a lot of money, but you get your last eye test. I mean, he was great last year. He made the offense better. There's been some accuracy things at times. Is it the system? Is it him? We see him with McCarthy. You get a final. I think if he throws for 5,000 yards and 30 touchdowns, this is a legit guy, and we can give him the longer term deal.
I mean, you don't see the contract, the player contract. What do you call it? Where you sign him for 1 year?
Franchise tag.
Yeah, the franchise tag. You don't see it that often in quarterbacks. You see it a lot in running backs.
Because people invest in quarterbacks. But now
Kirk was the one guy that we saw it over and over with the Redskins, and then he ended up with a long-term deal on the Vikings.
And you wonder, how do you feel? Would you want that contract if you were the Vikings right now?
To give it to him?
Yeah.
Oh, absolutely not.
it seems so. No matter, it's just who's the next starting quarterback up, who's the next man up, gets paid the most. And Kirk is a good, but he's not. He's not Deshaun Watson. He's not. He's not
like
Lamar Jackson.
10 to 15.
But the thing is, Lamar Jackson's only going to get paid more when he's the next man up.
Right.
When Matthew Stafford comes up after him, he's still going to get more. So it's almost like the middle pack quarterbacks will better than nothing. It's almost like, do you just let those guys go and you start? I said this about the Ravens before. Do the Ravens have a plan to keep drafting quarterbacks, get them on their rookie contracts, and hey, if Lamar is $50 million a year for 10 years, maybe they let him go to a team. I know it sounds crazy, but if you've got a good young guy in the wings, do you start to think about it?
I don't think there's many people with Lamar Jackson's skill set.
There's nobody without question. But at his skill set when he was a rookie, when you drafted him, what you thought it was, can you get a guy with a similar skill set? Does Trey Lance fall in the draft and you say, hey, maybe this is a guy that we can get to do this, and we get him on $4 million a year on a rookie contract, and then we keep this great defense and we sign a pass rusher? I'm just wondering, is that a thing? Do you think the quarterback contracts that are strangling teams, where Dalvin Cook can't get his money because Captain Kirk, who may not be as equally valuable to Dalvin Cook, maybe long-term quarterbacks last longer, do we start seeing something change with these quarterback contracts? Once it goes to $40 million, do we see teams saying, hey, we're just going to Jarrett Stidham this thing and see how it goes? And maybe the way that works out is you tank for a year and you get your new good quarterback after that. But the salary cap goes up so much every year. It seems like the quarterback contracts go up at an accelerated rate. How do you see this going?
I think, like you're saying, I think at some point these middle tier quarterbacks like Kirk Cousins, they're gonna stop getting the long term deal. I think they're gonna get short term. But I think a lot of teams are gonna start taking more sleepers in the drafts on guy like, who was that guy out
Jordan
of
Love.
Jordan Love went in the first round.
I didn't like it, but I think that was them saying, hey, Aaron Rodgers 37, we're not going to give him another big one. We'll run this guy on a young contract and see how he is.
Yeah, I mean, the Ravens traded up to get Lamar.
If anything, maybe they think about it from a negotiation standpoint when they go and negotiate with Aaron Rodgers. Oh, maybe as they transverse to a running team, his stats are less padded, and they got the rookie behind him. Said, well, you know what? We can win with Aaron Rodgers, but maybe he's worth $28 million a year. Not 38. Maybe that's some of the play with it. But it's interesting. I think the right move at this time is to tag him, and I think he should gladly take it. It's still, own it. If you play great, you're going to get $40 million next year.
If I was a quarterback, if I was Dak, I would want the longer term.
You want the safety, of course, right. But you can't always have everything. If they tag him next year, I think they got to pay him about 40.
Yeah, right. I mean, that's what happened to Kirk. The Redskins overpaid for Kirk for 3 years, right?
I would say Kirk's swimming in it right now. It worked out for him.
Because
he got the long term
every year, and then he got the
long term deal. Yeah. So you can win on this thing, you can lose on this thing. The thing that you have to do is keep playing well. I guess what Kirk bothers me more is that he just doesn't seem to come through in the big moments. He's a pretty darn good quarterback. I feel bad judging him on being in that offense where they don't really glorify the quarterback. He is a great quarterback. It's just he doesn't come through in the big moments. It's frustrating.
That's part of being a great quarterback.
Yeah,
you know who's the opposite?
Brady.
Joe Flacco.
Oh, come on.
Not good in the regular season, great in the postseason.
You got to be able to get to the postseason. you got to get there. Where's Flacco now? Flacco signed with the Jets. Oh, that's where his career. His career seemed very Jets. It's Jets driven right now.
One thing I wanted to tell you was
another Jets move. They signed a quarterback, and he won't be ready for the season. He had neck surgery. He'll be backing up Sam Darnold from the bench. Go Adam Gase.
My guy, who you
shout out to all the Jets fans listening,
always make fun of me for, is Mitch Trubisky.
Sure.
Yeah. So the word I'm hearing, especially James Conner is endorsing him, and it was somebody else on the Bears, was basically saying, like, Conner was saying, look out for Mitch Trubisky this year. He has been working incredibly hard over the offseason.
James Conner?
James Conner.
That's the Steelers.
Right, but they work out together. They somehow do some off-season things together. He was saying Mitch Trubisky has a fire in his bottom side, and he is going to be, they said, look for him to have a monster year. He sees him beating out Nick Foles and having career year.
Well, I really think that was the Bears. That's what the Bears want. I don't think
they overpaid for Nick Foles then.
Well, but that's the thing, though. I think they had to do that. I think they said the best scenario of this is we bring in Foles and Trubisky gets a fire under his butt and beats him out. And then but you got to pay for the guy to get him. And Trubisky with injury concerns, they had to pay for
Draft a rookie that can scare him. You know?
Okay, yeah, no, I'm always on board for that. But the worst thing you get is Nick Foles is competent. If he doesn't, then you got competent backups at quarterback are becoming important in the NFL.
Yeah.
Nick Foles won a goddamn Super Bowl as a backup quarterback, so that's what they want.
But he's played like in the last 3 years. I think he started like 7 or 8 games. Not many.
Won a Super Bowl.
I think Carson Wentz took him there.
Did he win the MVP? I think he won the MVP.
Hey, good postseason. So,
Super Bowl MVP. I mean, we're talking about you want to talk about, you said Joe Flacco, somebody who really is good in clutch moments, Nick Foles. Philly special, baby.
All right. Do you want to get into some fantasy football QBs?
Yeah, you want to just give the quick QB spiel for the year?
QB spiel. You're probably wanting Mahomes number 1, Lamar number 2.
Well, the start of the spiel is just don't draft a quarterback early. We've got to preface it that not everyone who listens to the show is a fantasy football expert and knows that. You can get beautiful value in the late tier ranges for quarterback this year. I recommend what I like to do, draft a safe one and match them up with a little high side risky one. You get a little Ben Roethlisberger, you get a little Daniel Jones, a little Matt Ryan, you get a little Ryan Tannehill. You go safe, you go risky, play the safe one. Hopefully the risky one blows up. Risky one blows up, you can cut the safe one and get another running back. But yeah, I would say Mahomes and Jackson are probably 1A and 1B. If you're drafting a quarterback, right now I'm drafting in best ball, and I will take either of those guys in round 5 of a 10-team draft, and I'm getting them there. This is guys who are playing best ball in June, so they know not to draft quarterbacks. They'll probably go in round 1 of most drafts, so I would say stay away from that. Lamar's regression based on his statistics last year has to happen. He cannot throw as many touchdowns with as many passes as he made. The statistical probability of it is very, very low. And he's a running quarterback, so the risk of injury is high. I wouldn't recommend drafting Lamar Jackson high. He's the best in the league, but there's a lot of risky factors there. So the tier after that, that's a little exciting, is you got your Kyler Murray. Do we get the year 2 boom and the most exciting offense, adding DeAndre Hopkins? It's always risky to pay for a guy who hasn't done it before, but he could be there. Russell Wilson and Deshaun Watson. Do you still buy him, losing his best option? I think if you can get Watson a little bit later, I don't think he drops off. I think he's a great quarterback. I think he can play with guys who aren't his superstar.
I hate their offensive system where it's run, pass, and then when we're down big in the 3rd and 4th quarter, all right, let Deshaun run around, do his thing.
But he always does it. And the defense is worse.
But you're always waiting for like 15 points in the 4th quarter to be like, I hope I have an okay day in fantasy.
The defense got worse. He should be throwing a lot.
But who's he throwing to? Is it Kenny Stills back there?
Yeah, Kenny Stills.
Will Fuller for a couple games.
Yeah, Brandon Cooks. Brandon Cooks has been a 1,000-yard receiver.
A lot of injury-prone players here.
1,000 yards, I think, 4 times in his career, Brandon Cooks, and everybody's trash. Nobody wants him.
He's interesting because he's always the number 2 receiver.
I think he had the best year on a Saints team
before they had Michael Thomas.
Yeah,
but after Joe Horn.
Whoa, Joe Horn was like 1998, man. What are you talking about? Dial him up on the celly phone, man. Find that in the goalpost. But I mean, your value. Let me pull it up to tell you where your value is. You can get, round 10 in a 12 team. You're looking at, round 10. You're looking at maybe Carson Wentz, Tom Brady, Matt Ryan, Aaron Rodgers, Stafford. Last rounds, you're looking at Goff, Roethlisberger, Daniel Jones, all guys that have plenty upside. You can wait and get your quarterback. If they're taking quarterbacks in round 1, get your running back settled. Get your quarterback later. You'll be fine. If I'm wrong, yell at me. Pay me. I'll fix your fantasy team later. You can wait. Don't stress at quarterback. They're flying off the board. It's okay. We get Jared Goff and Daniel Jones, and we got 3 stud running backs. We'll figure it out.
Take some Bridgewater.
I'm not too high on him, but why not?
I like him.
Dude, he does nothing but succeed. You didn't used to like him.
I didn't like him, but he's in a way different system.
There's some experts I trust that aren't having high enough projections on him for me to be all on board. But sure, throw a dart at him. I wouldn't take him alone. I would say, you want Bridgewater, go with a Carson Wentz with him. One of them will hit.
Yeah.
Wentz, if he's healthy, is a stud.
Well, let's get into our health topic.
Yeah.
We're talking knee osteoarthritis today.
Oh, my God. How often do you get a prescription for this?
Every day.
Every day.
Every day. Everybody's
Twice
always complaining about my knees.
Yes.
Knees always crack. Oh, my knees. You can't go to the restaurant without. Well, now you You don't go to the
You don't
restaurant
go
at all.
anyway. Now you're on the sofa. Oh, I'm getting up on my knees. My
Always
knees.
somebody talking about their knees.
Sure.
So it kind of started when we were talking about knee osteoarthritis, and back when I was going in school, and kind of the old thought was that the more active you were as a younger person, playing sports with strenuous, repetitive, weight-bearing things, basketball, cutting, jumping,
Hmm.
runners. That's a lot of pounding on the knees,
Hmm.
and it was thought that this was going to set you up for long-term, a higher chance in the long term of developing knee osteoarthritis. Now more of the research is starting to show that's actually not true. They're showing a lot of evidence saying that runners, particularly, there's no correlation that they're finding of running a lot in your younger years and having an increased prevalence of osteoarthritis developing earlier in later
Yeah,
years.
you pulled up some articles that you
Yeah,
found
I just
recently.
found a quick article. This one was done by Allison Chang and others. So, association of long-term strenuous physical activities and extensive sitting with incident of radiographic knee osteoarthritis.
Okay, I want to stop you there for 1 second, and I just want to let's put the research aside because I kind of want to go into how a physical therapist interprets research and how they relate it to their actual clinical experience. So I just want to hold you there, and I want you to give me just in your clinical experience. You've taken subjectives of people who said they've run their whole lives, and you've taken subjectives of people who are complete couch potatoes. How do you relate to your clinical experience? What you see in people? Do you think is it sedentary people that seem to have less knee OA? Um, moderate people, your everyday walker or your runners. Do you find a correlation in your subjectives that you're taking with people? You think there's one of those populations that you see it more or less in?
You definitely see it more. It depends kind of what you're looking at. A lot of people that have knee pain that come in, it's already an X-ray shows, hey, I've got moderate arthritis.
Mm-hmm.
Arthritis is a continuum, right? You're looking at space between in the knee, the tibia, and the femur. So, everybody has a little bit of arthritis in a sense. There's
100% of us.
right. So we're looking at moderate to severe, where there's not much of that cartilage in between it that you're starting to think that's associated with pain. As a physical therapist, I don't think we necessarily correlate osteoarthritis to pain per se.
That's a huge one. Go further into that. Explain to people. That's a really big topic. Explain why that is.
Well, I mean, you're looking at alignment is a big part of it. So alignment meaning when you're weight bearing on the ground, are your knees caving in a little bit? Are they bowing out a little bit? Kind of where the forces are going. In a perfect world, you have equal. So if kind of here for the Facebook Live people. So if here is your tibia and here's your femur kind of directly on it, you want it directly on it, right? But if there's a little bit of kind of a little bit of valgus or a little bit of varus, sorry, you'll start to see different patterns of weight bearing and different patterns of osteoarthritis. So you can have medial compartment arthritis, you can have lateral compartment arthritis, you can have tri-compartmental arthritis. And a lot of times when I look at that, it's saying, okay, well, now it kind of confirms that, their knees going into a little bit of valgus. And from biomechanics, we know that that is going to put more pressure on the lateral part, right? And you can start to correlate your findings of what you're seeing, but again, not necessarily correlating to pain.
That's what I want you to expand on. So a stubborn patient comes in and they say, doctor says I have knee osteoarthritis. They say there's nothing you can do to make our arthritis better. You've mentioned structurally how you can make some changes as a physical therapist to take some pressure off, maybe the most pressure, but what could you do for that patient besides change their arthritis that might be beneficial to them?
So it's muscular, right? So you can improve strength.
So, but you're saying that maybe there's the correlation between knee arthritis and pain is not a positive correlation, or if it is one, maybe it's not a very strong one.
Right.
Meaning we do a lot of X-rays, and we do X-rays on people with knee pain, and we see ones that have little arthritis, and we see ones that have a lot of arthritis,
Correct.
And their pains don't seem to correlate with that amount very much. And we don't do a lot of X-rays on people who don't have pain, and when we do, we find that some people without any arthritis don't have any, or some people with a lot of arthritis don't have any knee pain at all.
Right. You could do one study that shows before PT, right? Okay, we think arthritis correlates to pain. But then you do that same study after PT, and all of a sudden I think you're going to get a lot different results because 99% of the time, PT is going to take away that person's pain and get them back to whatever function they were before.
So the pain could be coming from something besides arthritis, which in my case, the nerve endings within the actual cartilage of the knee, I think most people we come in, I would say a high percentage of them leave pain free. And I think we're doing something besides changing arthritis, meaning that something else might be driving that knee pain, even though the radiographic diagnostic is obviously what we're looking at as the arthritis. We're making some other changes that are relieving that pain. So pain and arthritis not perfectly correlated. Very important to know. But I still want you to just backtrack into some of the studies. What's your recommendation? I come in and say, hey, I'm 30 and I've got a little knee pain, and my doctor says there's a little knee arthritis in there. He did a radiograph. Should I be should I lay on my butt all day? Should I get out there and do a lot of strengthening and running, or should I be a walker? What's your PT take?
Yeah, I mean, it all kind of depends on where you're coming in, right? So if I have a high level athlete and now all of a sudden they're having a little bit of knee pain with lunging or cutting or running, I'm probably going to back them off a little bit and work on trying to figure out what's causing their pain. So whether again that's alignment or whether that's a weakness or an inhibition, a lot of times you'll get an inhibition of the quadriceps, which can lead to more stress on the knee joint itself. So as a physical therapist, you can facilitate muscles, kind of turn them on in a sense, get better initiation. So it's not just like you have arthritis, you have knee pain, put them on the leg press, put them on mini squats. It's definitely not a one size fits all.
Right. But the answer that I'm hearing, to simplify, and it's sort of redundant of this podcast. We could almost change the podcast name to something like this. So it was a little boring to say, but the truth in my answer and what I'm getting from you is it's balance. There is
not literally balance.
No, not working on your physical balance, but actually there is a degree of exercise and loading that you can do that's very likely too much for your knee, that may lead. Now, some of these articles looked at that activity level,
Sure.
that actually stressing the joint didn't seem to make a difference. But something else they don't look at is people who are more active are likely to sustain more injuries than someone who is inactive.
That's huge.
So when we're looking at the difference of multiple injuries to a cartilage surface, that paints a different picture for arthritis. So I find in my clinical experience, the healthiest people usually are moderately active, and particularly, we see older people a lot with knee OA. They're usually the healthiest ones are usually the walkers. 70-year-old runners, I'm usually seeing more knee breakdown in them, and the couch potatoes, that they get less stimulation. So you've got synovial receptors within your joints. If those receptors are not stimulated, they don't produce any synovial fluid, so you get tissue breakdown within the knee. So I think there's a balance, and I think everyone's different. So some people can handle a little more, some people can handle a little less.
Honestly, with knee pain, often I'm not, definitely check the knee, check strength, check how the patella moves, check different things like that. 9 times out of 10 for me, I'm really treating a lot of times more the ankle or the hip.
Sure. For again, like you said, the alignment. And Spencer just commented, treat the person, not the image. That goes into treating knee arthritis, and that we'd have to look at your entire body, what's going on that affects the knee.
Yeah, even if not alignment, you put somebody, can they stand on one leg? No, all of a sudden their foot's collapsing and they're losing their arch. Well, now the knee's coming in. Different reasons. Some people have back pain that's going to internally rotate their femur. A lot of different things can play a role into why somebody's having pain in the knee. So for a doctor or anybody to just go in and say, you're having knee pain, let me x-ray your knee, oh, you have arthritis, that does not mean that we're just going to treat the knee and kind of.
I think we both think that that's probably not, that most of the time that's not driving the problem, but people like to hold on to a diagnosis, so it's nice to have, oh, this is my problem, I know what it is, so it's not the worst in the world. Go ahead.
Well, let me start to question you a little bit. So with all these findings, so say somebody does come in with osteoarthritis, right? Mm-hmm. Moderate to severe, there's not much cartilage in there, and they have certain exercise programs that they like to do.
Yeah.
Maybe they have a high intensity exercise, something like a Beachbody Insanity or a P90X, or one of these things that has a lot of jumping and has a lot of higher impact weight bearing activities. Looking at these studies and seeing that, it does not necessarily seeing a correlation between a lot of weight bearing pounding and things like that to arthritis. If somebody has arthritis and you get rid of their knee pain, are you comfortable getting them back to a high impact exercise program? Or would you say, you know what, I think your knee arthritis is at the point where we don't want to put too much more pressure on it, and I'm going to have you do more lesser impact activities?
Again, that would depend on the specific individual and how important those activities are to them. But that goes back into what we were looking at, some of the research. And I think being a researcher, you see things from a research lens very well, and being a clinician, you see things from a clinician lens very well. And the truth is, we sometimes see something different when we look at it. So a lot of these research, you're looking at a very small sliver, and you're not seeing the big picture on every patient that comes in that we see every day. So someone who's having pain with pounding all the time, if it hurts to pound, you're creating some type of irritation in that area. Now, what we said with acute injuries that can lead to more arthritis, potentially, if you're creating inflammation and chronic injuries, you could be having chronic injuries that are relating to more breakdown in the area. So in that area, I would say the specific articles that you were looking at here don't give a full picture of every injury. So I think that pounding, in a lot of cases, can cause more arthritis. So I would see how important that exercise was to that individual and probably say, well, why is that important to you? Well, I want a good looking butt. Well, then let me bring you to some other butt exercises that aren't so pounding. Usually the actual activity itself isn't the most important thing, and they can be modified. But I think it's important to understand how tissue reacts in general too. So if you do the perfect regimen your entire life, you're still going to get arthritis. An aha moment for me, thinking about arthritis, is just when I broke down, and this makes sense to all of us, but we don't think about it, is that when I realized that dogs get a lot of arthritis at age 9, and humans don't even stop growing their entire cartilage formation until 16. So what is different? It's the physical embodiment of cartilage. It's not just breakdown on that. It's our bodies, our DNA's ability to replicate that tissue over and over and over that keeps it healthy. The telomeres that are in every DNA and in the cell of your body, some are shorter on some people and some are longer on some people. And when those start to run out, you're going to have less replication and you're going to have cell die-off and get arthritis regardless if you do the perfect thing. So some people are just going to get arthritis. You've got to put yourself in a situation where you're getting the balance and the neutral of the healthiest way. You don't want, if you're having, you got short telomeres and you're getting cell die-off, you obviously don't want to have all your compression on your medial compartment and cause more irritation and breakdown in that area. If you can unload that, you can sustain longer. We like to say we want to make everything perfect, but we all meet our maker someday, and tissue breakdown goes along with that. A good look at the inside is what you're seeing on the outside. We do age, and that happens to the joints too. It's normal and healthy. It doesn't have to be a painful process. And
well, one thing we see a lot from our patients, or hear a lot from our patients who have knee pain, or maybe even a little bit older, have been diagnosed with severe osteoarthritis. They want to know, is there any type of passive treatment that they can do, because active treatment is painful for them. So they'll ask about things like knee braces, for example, is a common topic among people that have knee pain. What are your thoughts about putting somebody in a knee brace? And is that going to, say somebody's got moderate arthritis, can you slow it down with a knee brace by unloading certain compartments of the knee? Just what are your takes on knee braces in general, and should more people be wearing knee braces?
Yeah, I mean, we could bring on, Shane and, someone who's specialized in braces to go a little bit deeper into the details of that. But the unloader braces, I mean, just the numbers I've looked at, I don't know how much they're really unloading the knee.
Clinically, do you use them a lot?
No.
No?
I find most patients, if we can align them and teach them to be aligned and work on motor control to maintain that alignment, they do well. Think about it. You got 220 pounds on your knee.
Whoa.
Okay, what do you want? 208?
215.
215? Okay, 214 maybe. It's been a good day, had a salad. How much is externally loading something on your skin going to unload it? It's like I said, it's not expensive, and if people reporting it helps them, then I think it's great. From the physics standpoint of changing arthritis, I don't know that I can see that it changes the arthritis a lot. But same thing that I said, we don't change the arthritis for treatment, and sometimes doing external output things are very helpful. So I think being the physical therapist, I'm going to say, I want good alignment. I want your muscles to be able to control that alignment, not for you to crutch it with a brace and be able to do it. But it's always, not everyone's different. Some people, hey, I don't want to do my exercises. I find the braces helpful. That's fantastic. Do that.
Yeah.
I had the same thing with foot orthotics for the longest time. I wanted to fix every foot, so no one needed orthotics. I found I was giving some people 5 hours of exercises a day because their feet were so terrible, and that's just not in everyone's day plan. So they wear the orthotic and they do great. It's a type of crutch, and I think it It can be used in some situations. I find my patients, I have a lot of success without going that route, but
Yeah.
I definitely wouldn't knock them. I think they're okay.
Yeah. All right. Good.
Growing arthritis, stem cell injections has shown some research that they can grow back a level of arthritis. We know we've seen Centano's research. Some people question how that research is. I think I've definitely seen some positive things in it. I've seen a patient who showed cartilage growth, though, like we said, is the pain coming from the knee arthritis. They didn't really have pain relief with that cartilage growth.
Right.
But definitely some interesting things to research for the future about stem cell injections changing the level of cartilage in specifically the knees, but all joints.
Yep. You got what, the glucocorticosteroid injections.
Sure.
Cortisone is often a big proponent in trying to get rid of some of the inflammation in that area.
People are afraid. They say it's just temporary. Hey, sometimes if you can knock that inflammation out for the patient you said that needed the brace, you knock that inflammation out, and then all of a sudden you are free enough of the inflammation to work on your motor control a little bit. And you know what? You get good alignment, and the inflammation doesn't come back after the injection. So they're not the worst thing.
For sure.
People are afraid of them because the stories from the 70s of football players getting their knee injected every day, and then it obviously creates tissue breakdown, and they're blowing their knees out. Yeah, it's a concern. But if you get 2 injections a year for a couple of years, probably I would say I wouldn't be overly concerned about.
I've actually had a couple of patients recently with knee pain that came in with a lot of swelling in their knee,
Mm-hmm.
and so as we know, swelling on the knee can actually inhibit the quadriceps from firing effectively.
100%.
So we actually had to send them back to their doctor to have some fluid drained,
Mm-hmm.
And then they came back, and then we could do some of our facilitation techniques, and that helped them out quite a bit.
I love that. It's a great story.
But I'll use braces. I'll use cortisone injections, whatever I can to help improve some function.
Sure.
A lot of times I'm doing a brace, it's only because, hey, I'm going on a hike with my family. I really need to get 3 miles. Well, comfortably you can go about half a mile right now. So let's put on a brace and see if we can get you a little bit further.
I love it. Balance.
Same thing, knee taping, a lot of different ways to kind of to get at getting more function. But
sometimes you just need the straw that breaks the camel's back to get you through a little bit of it.
And sometimes mentally, it just people feel better. Hey, I've got this external support. I feel better. Now look, I can go an extra half mile.
Don't knock it, but I'm not saying this about braces, but in general, the placebo effect is one of the strongest drugs we have. We know that there's studies that give people sugar pills and tell them they're sugar pills, and they still get better.
Sure.
And correlated to someone who's actually getting the correct medication. Yeah. So it sounds bad to say that the placebos work, but placebos are fantastic.
Well, they used to do sham surgeries. Cut them open, play sounds like it's surgery, close them back up, not actually do anything. People say they get better.
People like interventions. People like, I have this, so it did this, and now I feel this. Good.
Yeah.
Yep. Half the game is mental.
Yeah. All right. Well, tell us what you think. Maybe if anybody has questions about knees in general, anywhere in the body.
Yeah, well, I think we got through that pretty clear. What we're saying is, and I'll synopsis it. Being a couch potato is not good for your knee joint. Being a super pounding athlete, though some research says is not too effective, I still believe is effective. There's a balance somewhere in between. I think that's the right answer.
Yeah, sedentary. The more weight you have physically going onto a knee joint, the more that's going to wear. I mean,
but if you got nothing too, you go up into space and you put no weight on your bones for a while, and all of a sudden you've got bone breakdown. So yes, balance.
Yep, for sure. All right, well, send us in your questions, willandmarkshso@gmail.com. Comment on our Facebook page, like us on or follow us on Instagram, and we'll see you next week.
Over and out. It's a good one.